Hi, Stephen. Thanks so much for agreeing to chat with me today. I wanted to sit down and talk to you because as we're entering this kind of back to school season, cold and flu season, this is the time of the year when normally we're thinking about getting vaccinated, right? Ourselves and our kids. But this year things are a little bit confusing. There have been some mixed messages about what might be available, what might not be available, and what the best course of action is to keep ourselves healthy as we enter this season. So as a pediatrician and a public health expert, I wanted to sit down with you and clarify some things for anyone who might have questions. In normal times, what are typically the vaccines that are recommended for kids to get during this time of year?
Well, first off, we start with the routine childhood vaccines that kids get. And so that really provides a foundation for being healthy. And then as we enter respiratory season, we are thinking about flu and COVID vaccines. We know that they're safe and effective, and they help prevent illness, severe illness, and hospitalizations in cold and flu season, which are really bad in many winters.
This year, going into the season, as we're already seeing an uptick in COVID cases and have been getting into the end of the summer, there's also been a lot of questions about what getting vaccinated for COVID or getting a booster is going to look like this fall. Recently, the FDA did approve a new round of COVID vaccines, but for a very limited group of people, just people who were at high risk of getting sick, which doesn't necessarily include a lot of kids. So with that in mind, and knowing that we're also still waiting on the CDC's Advisory Committee on Immunization Practices to meet later this month and give their recommendation, what could access to COVID vaccines look like for your typical kid this fall?
Well, there's a lot of worry about that. This has never been an issue before. As we walk through things, we look at the science and the data, and then there's recommendations from FDA and then ACIP. This year's different. We saw FDA scientists being overruled, reportedly in their recommendations. We're waiting for ACIP to meet, but in that context, we have resignations from CDC of people that were specifically worried about this ACIP meeting, that it wasn't going to follow the evidence. So that leaves all of us, and it leaves parents in this place of, well, what am I supposed to do? Who am I supposed to believe? Time and time again, we ask parents, we poll parents, who is your most trusted source of information for the health of your child, for immunizations, for public health information? And it's their child's doctor, the pediatrician, family doc. So find that person and talk to that person. Don't listen to social media. There is so much misinformation that parents are walking through. And I'll tell you that as I sit down and talk to parents about vaccines, I've never met a parent who's not just trying to do the right thing. And they're filtering just so much information. So talk to your pediatrician. But as a pediatrician, I would recommend, and the American Academy of Pediatrics recommends, immunization against flu and COVID. We certainly saw deaths from COVID from healthy kids in the past. That has been disputed, but we did. Every year we see deaths from flu. So let's protect ourselves and protect our communities.
In the past, it has always been recommended for pregnant women to get a COVID vaccine, also to protect their unborn child, to give them some immunity when they're born. But pregnant women also aren't included in that approval from the FDA. So would you say something similar for pregnant women who may be worried about COVID going into this fall, that they should turn to their doctors for advice?
I would, and as I'm the type of pediatrician that practices in a newborn intensive care unit, so I'm a newborn intensivist. During the height of COVID, we had babies that were being born preterm just because their mothers were so sick from COVID, and that memory for me is still ingrained of walking into delivery rooms with all of our garb on because mom was COVID positive and sick. And the infant otherwise was healthy, except for had to be born preterm because moms were so sick. So we know that vaccination in pregnancy, it protects mom and provides some immunity, some passive immunity to the newborn after they're born too. So it's important. And ACOG recommends it. So here again, have a conversation with your obstetrician about COVID vaccine. But the research, the data support that it works.
And thinking too about pregnant women and about newborns and the things that we do to help protect them from the very beginning of their lives. Something else that ACIP is set to discuss at their meeting later this month is the hepatitis B vaccine, which is something that we typically give to newborn babies right at the beginning of their lives. So, hepatitis B vaccine hasn't been in the headlines the same way that the COVID vaccine or MMR vaccines or some other things have been. So not everyone might know exactly why we are immunizing newborn babies for that. So could you explain that? Why do we give the hepatitis B vaccine to newborns?
Well, it's to prevent transmission from mom to baby. And we give it early on, and we give it routinely. It's first off, it's very well tolerated, but it also reduces the risk that there is transmission from mom to baby or from communities. We know that infants are at much higher risk of having developing chronic inflammation of their liver if they are infected. And so it's one of those steps where we can prevent a disease, and so that's what we do.
Preventing disease is obviously the entire ethos behind all of our routine childhood vaccinations. So as we enter into a time where, between some regulatory decisions or different decisions from states about vaccine requirements are changing and things might be becoming less accessible. What happens to not only children's health, but the health of whole communities if less and less kids are able to be vaccinated?
So the worry is we've done such a great job of getting rid of diseases like polio, that decimated communities not that long ago. And so the worry is we have a resurgence of those diseases among children, which can have lifelong complications. But we also start to see we see diseases spread, and then it'll spread to folks who are adults who have waning immunity. So really this is about protecting our kids, but it's about protecting all of us. One thing I'm mindful of is that there are many diseases my patients in the newborn intensive care unit can't get because they're too young. There are other kids who can't get immunizations because they have cancer, for example. So the way we've approached this always in the past as Americans, as citizens is, I'm gonna be vaccinated to not just protect me, but also to protect you. And it's just worrisome we're in this place where we're being told all this misinformation that's beginning to erode that contract that we have with one another to be there for each other.
With all of that in mind, as we are entering into this respiratory virus season, we're already seeing those COVID cases climbing, and we may not be able to all access the vaccines that we want, and especially for children, if parents are worried about their children's health, their family's health, especially for, like you mentioned, some of those immunocompromised kids and family members, what can parents do to help keep their families healthy as we enter this season?
Well, first is, talk to your family doc, your pediatrician about vaccination or about specific risk factors you may have that would qualify you for vaccination or your child for vaccination. But the general things we do to prevent disease spread. So if you have a cold and cough, if you have a fever, like those types of things, keep your kid at home, stay at home, do the typical things that we know work. Wash your hands, have that hand sanitizer around as you're going through the season. Avoid kind of, maybe big groups depending upon where things are, if there's high disease spread. I think one of the challenges we face right now are all the unknowns heading into the season. We're already seeing COVID in the community, and we don't really know as we approach the respiratory season, what's flu gonna be like? What's COVID gonna be like? So what I worry about is not only the disease spread in communities, but the stress and strain it could provide on our resources. Children's hospitals, for example, during respiratory season become very stressed. If we see a big resurgence like we've seen in years past, I worry about the stress that can provide on our systems.